Hey there, it's January 28th, 2022 in British Columbia, Canada. Things are getting pretty interesting. BC's health officials recently announced extending the vax mandate until June. The Canadian and US federal governments recently removed the vax exemptions for truckers crossing the border, and the convoy is just pulling into Ottawa. Let's take a quick stroll down memory lane to see how we got here, and we'll see where we're at.
That this virus has shown us that there are inequities in our society that have been exacerbated by this pandemic. And there is no way that we will recommend inequities be increased by use of things like vaccine passports for services, for public access here in British Columbia. And that's my advice, and I've got support from the Premier, and I have talked about this, Minister Dix, and others.
Then, despite that very specific and direct statement, and Stats Canada data seemingly backing it up, BC's health officials, with some amount of alignment from the federal government and a $1 billion pledge from Trudeau, then did a complete 180.
We'll continue to work with the federal government to make sure we have an alignment with the federal passport, vaccine passport that's under development as well. Also, transmission among unvaccinated people mean that further action is needed to help reduce transmission, to keep all of our businesses open and ensure we can continue to enjoy the social events that we have been able to through the summer as we head into the fall. So a new provincial health officer order will require individuals to provide proof of vaccination, our BC vaccination card, to access certain social, recreational, and discretionary events and businesses throughout the province.
Then on September 10th, Theresa Tam, Canada's chief public health officer, then went on to seemingly admit that these mandates were not based on any established science, but were at least in part meant as a coercive carrot on a stick to drive up vaccination rates.
Dr. Henry or others may have also indicated that a certain uptick in people making appointments after they announce their policies. So it is, I think, as a measure, as a one way of encouraging vaccine uptake, is something that we should place close attention to and study, and that also helps other jurisdictions should they want to make these kind of decisions. The question prior to that, which is, do locally implemented requirements for vaccines to access non-essential services, for example, work, that I think remains to be seen.
September 13th, a BC provincial health order mandated all healthcare workers have received their first dose of vaccine by October 26th or be put on unpaid leave, then terminated by November 15th. Federally, mandates were also enacted for federally regulated transport sectors and the federal workforce, including the Royal Canadian Mounted Police. September 15th, the BC Nurses Union came out in opposition to the mandates for healthcare workers, looking for employers to instead extend other precautionary measures, such as testing or PPE, to unvaccinated workers. The reasoning was the posing of, quote, desperate staffing challenges in work sites where staffing is already stretched extremely thin, and that taking nurses away from the bedside will have serious impacts on patient care. The following day, September 16th, Mr. Trudeau went on French TV and stated that those opposing vaccination don't believe in science, are often misogynistic and racist, while seemingly agreeing with the House that they're also extremists. Totally oblivious to the widely published, significantly lower vaccination rates amongst both pregnant women and some visible Canadian minority groups. In one of the most shocking statements from the leader of a Western country, he then went on to state that a, quote, choice has to be made whether or not to tolerate these people. Listen.
Hésiter un petit peu, on va continuer d'essayer de les convaincre, mais il y a aussi des gens qui sont farouchement opposés à la vaccination. Qui sont extrémistes. Qui croient pas dans la science, qui sont souvent misogynes, souvent racistes aussi. C'est un petit groupe, mais qui prend de la place. Et là, il faut faire un choix en tant que leader, en tant que pays. Est-ce qu'on tolère ces gens-là?
Then on November 4th, among all these massive social and economic upheavals, after having just announced that 3,325 healthcare workers, or about 2.6% of BC's workforce, was put on unpaid leave, nearly 2 years into the pandemic, Bonnie Henry finally took a question and discussed that massive elephant in the room, natural immunity. There's 3 main points I'm going to split up for clarity here. Bear with me for a few minutes while we get through it. I think it's really important.
And we've just, the BC CDC has done I think the 5th time we've done a period in time, a snapshot of the percent of people who have serologic evidence of a previous infection or from vaccination. And we can tell the difference between having immunity from vaccination and having immunity from previous infection. So hopefully we'll have those data to publicly very soon.
Nearly 2 years into the pandemic, she states that they have their own data and they hope to make it public very soon. It's almost the end of January. Nearly 3 months later, I still have not seen that data. Maybe it's out there. I don't know. I can't find it. Point number 2.
I will say, though, that this is a really important question because I hear all the time that post-infectious immunity is better than vaccination, and I've said this also in the last couple of weeks. There has been a number of studies, small studies, that show that yes, people who are so I think we all agree that for a period of time after infection, most people have immunity. But that varies. It varies depending on your own immune system. It varies depending on how severe the infection was. Some people who have very mild infection, it doesn't stimulate the cell-mediated response of their immunity. I don't know. You probably don't need to translate all of this, but and then some people who have very severe infections, their immune system gets overwhelmed, and if they recover, they may not have strong immune protection for a long period of time. And we know that it varies how long that protection from an infection lasts.
Okay, so she states that natural immunity exists, but it varies depending on several key factors. Now, a good follow-up question would have been if vaccination effectiveness also depends on several key factors. Looking at the COVID case rate by vaccination status data provided on the BC COVID dashboard on November 4th and January 4th, just 2 months later, it would seem apparent that this is also the case for the vaccine. Now, I'm going to let these charts bake in for a sec because this rapid change in caseload by vaccination status is really important. On November 4th, the partially vaccinated and the unvaccinated, comprising roughly 20% of the entire population from all age groups, made up around 65% of the COVID cases. 2 months later, that similar size group made up roughly 15% of COVID cases. It seems clear that this drastic change is almost surely because of Omicron, but let's think about that for a second. According to the BC government's own data, they were well aware of the rapidly changing landscape of COVID-19 variants and their effect on the various key metrics. So the idea of leveraging natural immunity was dismissed, at least in part based on the idea that it varies depending on several factors. Then they were seemingly taken by surprise by what their own data was telling them, which was that a new variant would eventually emerge and have some unpredictable effect on vaccine efficacy.
And just this week, there was a very good study came out of the United States looking at, on a population basis in one of their HMOs, so hundreds of thousands of people, and it looked at people who were infected with COVID and people who so all of them had previous infection. Some of them were vaccinated as well. And the risk of having a second infection was 5 times higher in people who were not vaccinated than people who were vaccinated.
So Bonnie Henry referenced a study from the US released that week involving hundreds of thousands of people that claimed a 5 times reduction in reinfection via vaccination. Now, I did a fair bit of digging around and found one report released that week that fit all those parameters, including the date. So I'm fairly certain this is the study she's referencing. I couldn't find anything else even close. First thing to note is that I believe she was slightly mistaken in describing both groups in the study as having prior COVID infections. This report in question compared unvaccinated people with a prior infection to fully vaccinated people without a prior infection. Without getting too deep in the weeds, here are just some key concerns with this study. 1, there was numerous noted conflicts of interest involving authors and pharmaceutical companies. 2, there was a noted limitation that residual confounding might exist because the study did not adjust for behavioral differences between the comparison groups. This is a major consideration. 3, there was a noted lack of understanding of changes in infection versus vaccine-induced immunity over time. Again, this is significant. 4, there was a noted potential misclassification of patients. 5, I found it very odd that they limited the analysis to patients that had had at least one COVID test more than 14 days prior to the hospitalization to, quote, limit analysis to patients with access to testing, end of quote. In other words, they excluded people who were in the hospital getting tested for COVID, but had not been tested at some time prior to that because they only wanted to include patients with access to testing. I'd be really interested to see how this affected the data. 6, they adjusted for socio-demographic and health characteristics with very limited detail on those adjustments. The specifics here could result in huge variability in the results, without a doubt. Finally, the entire foundation of this study was the measurement of positive COVID tests for people hospitalized with COVID-like symptoms. Look at the wording. Then this report and its corresponding author and CDC employee, Catherine H. Bozio, then goes on to recommend that all eligible persons should get vaccinated. Looking at everything above, I don't think it's unreasonable to consider the likelihood that this was not a serious and objective parsing of data. And more recent studies on natural immunity seem to indicate that. December 29th. With BC's pandemic update website showing 84.1% of COVID cases being among the fully vaccinated, with large numbers of unvaccinated nurses still off duty as a result of the mandates, with nurse shortages and the postponing of surgeries as a result of spiking COVID cases, Bonnie Henry made the following statement that was once again met with serious and meaningful objection from the BC Nurses Union. This one's a doozy.
Healthcare workers becoming sick with Omicron in the next little while, and seeing if there's ways that we can have healthcare workers, for example, with very mild or asymptomatic cases, working in some aspects of healthcare with appropriate precautions in place. So yes, we are looking at those in detail.
Okay, so let's recap. BC laid off thousands of unvaccinated nurses on the basis that they were a risk to spreading COVID to patients. Despite the availability of rapid testing, alternate accommodations, and PPE, as recommended by their own union, and despite the fact that many of them likely had some level of measurable natural immunity that was being ignored, then within less than 2 months, when a new variant emerged, something that should not have come as a surprise to anybody, and COVID spread increased dramatically among the vaccinated population to the point of causing concern for overloading the healthcare system, with surgeries then postponed, our healthcare officials' next move was to seriously consider allowing COVID-positive nurses to return to work, despite thousands of unvaccinated nurses sidelined at the time. BC health officials finally discussed the idea that COVID hospitalization numbers that were foundational to some massive social changes included significant numbers of incidental patients, otherwise known as people who are in the hospital with COVID, as opposed to from COVID. The idea of separating reporting on these two groups of people seemingly novel or not important enough up until that point to warrant the effort.
And so we need to know, one, is it because of COVID and Omicron that they're being admitted? Or is it an incidental finding? And then we need to have an understanding of how long this trajectory is going to go. So we've been trying, as we have across the country, to try and separate this. This has not been as
With measure after measure introduced over the past 2 years with the goal of stopping the spread, and with huge numbers of small businesses closed permanently while big box stores were packed to the gills, with thousands of people fired from their jobs, excluded from regular society, and lives upended, with children's futures altered forever, and with skyrocketing inflation, crippled supply chains, increasing poverty, suicides, and drug addiction, with a nation more divided than ever, With gyms closed and social interactions limited and the overall health of our nation deteriorated in almost every conceivable way, with still no measurable metric provided to citizens by health authorities indicating a goal at which we can return to normal life, to now be told by our health officials that catching COVID is essentially inevitable, we're really forced to ask ourselves, has it all been worth it? We can no longer ignore the long-term consequences of this current path, and people are starting to catch on. After 2 years of fear, division, flip-flopping, false hopes, and failed policy, people are starting to come to the inevitable conclusion that we can no longer trust our health authorities to dictate every aspect of our lives anymore. The idea of autonomy, to be free to make choices about your own body, is so rooted in the medical profession, it's one of the principles of medical ethics. There's a much larger health crisis coming if we continue down this road, and it will last for generations. As I speak, there's a convoy of truckers pulling into Ottawa with this exact message, and it has sparked a global movement. Don't be fooled by state-funded media spinning the story like they always do. Don't be fooled when Antifa causes violence like they always do. The message of this movement is clear. We are not anti-vaccine. We are people of all vaccination statuses, all races, all backgrounds, all genders, all ages, mothers, fathers, truckers, doctors, nurses, lawyers, police officers, military people, you name it. All with one voice saying loudly and peacefully, enough. End the mandates. Do it now.